Please start.
A very good afternoon to all the participants. On behalf of the Department of Foods and Nutrition, Faculty of Family and Community Sciences, the Maharaja Sayajirao University, I welcome you all in National Nutrition Month 2025 celebration. Before before starting today's webinar, I would like to invite Professor Vanisha Nambia, ma'am, in charge at Department of Foods and Nutrition, Faculty of Family and Community Science, Deputy Director, Office of International Affairs at the Maharaja Sayajirao University.
Abhishek, you're not audible.
Am I audible?
Louder, please.
Before starting today's webinar, I'd like to invite Professor Vanisha Nambia, in charge at Department of Foods and Nutrition, Faculty of Family and Community Sciences, and Deputy Director at Office of International Affairs at the Maharaja Sept University, Baroda. Over the past 33 years, she has been engaged in academic and research in the area of public health nutrition, government programs and policies on maternal, infant, and young child nutrition, underprivileged nutrition, school health, food science, antioxidants, NCDs, preventive dietetics, international health and women empowerment, including projects on childhood obesity and behavioral change communication models for improving child health and nutrition. She has completed over 33 research projects funded by WHO, UNICEF, Government of Gujarat, and CSR of reputed industries. She is the core team member for the curriculum development of nutrition and dietetics for National Commission of Allied Healthcare Professions and Ministry of Health and Family Welfare. She has published 75 research papers and 9 books. I welcome you, Anisha ma'am. I would like to hand over the presentation to you.
Thank you so much, Abhishek. I welcome our own alumni, Priyanka. And before she begins, I thought, let me just share about the department. Let me know if you can see my screen.
Yes, ma'am.
Okay. So very, very good afternoon to everyone who have joined on Zoom as well as are watching live on our Facebook. I'm very happy that the Department of Food and Nutrition is celebrating the National Nutrition Month 2025. And this is second webinar. And today's speaker is our own Priyanka, whom I have taught and so proud of her that she's doing wonderful work and she'll be talking on IYCN Stunting Nexus. A bit about the Maharaja Sayajirao University of Baroda, which is situated in Vadodara, Gujarat. And it is started by our own Sayajirao, named by Sayajirao III, and hosts the Lakshmi Vilas Palace, which is larger than Buckingham Palace. And I invite all of you to come and visit our city. This university is large, has 7 urban and 2 rural campuses of a total of 272 acres, and it has around 14 faculties, 112 departments, and has 8 institutes, and our Faculty of Family and Community Science is one such faculty. We belong to the Faculty of Family and Community Science, which hosts 5 departments, that is Department of Foods and Nutrition, Department of Clothing and Textiles, Department of Family Resource Management, Extension and Education, and Human Development and Family Studies. Our Department of Foods and Nutrition was established in the year 1950. It is a premier institute for higher education, which offers comprehensive programs at undergraduate, postgraduate, and doctoral levels. And our department aims to create world-class committed public health, dietetics, and food science professionals and work not only for India, but for the global community. And our mission is to persistently update and enrich our curriculum, conduct research in ongoing and emerging areas of nutrition, and partner with various stakeholders to improve nutrition outcomes of the Indian populations through evidence-based advocacy and national program implementation. We are in vogue and we have already adapted the NEP with which and we will be entering the 4th year soon. We offer 4 undergraduate programs: dietetics, public health nutrition, food science and quality control, and food and nutrition, which is a higher payment program. And we offer 2 specialization in masters, that is MSc dietetics and MSc public health nutrition, 2 PG diploma program after your graduation, which is food service management and PG diploma in applied nutrition. And we have a comprehensive doctoral program. Our department has grown since its inception in 1950 till date, and we are engaging in promoting research and training in all areas related to nutrition and dietetics. So the key highlight of our curriculum are fostering innovative and problem-driven research. Our curriculum is definitely, it creates an environment of critical thinking and problem solving, and we use real-life problem-oriented research. So Foods and Nutrition Department at MS University, it does not engage in teaching, but also extension work for the development of the community, mindful research, and we're also engaged in administrative duties. We have dietetics, food science and quality control, and public health nutrition, which has an operating philosophy of evidence generation, capacity building, system strengthening, and advocacy. We believe in partnership building and convergence, and we work in all settings for improving our health and nutrition status of the community. Our staff are engaged in several private and public sectors and also at national and international levels. We have a very innovative service to the society, a free nutrition counseling center, which runs 3 days a week. And it was started in 2013 to serve the community of Vadodara city. Our public health nutrition as well as our food science and quality control are also having operating philosophies which are involved in system strengthening, capacity building, partnerships and convergence, and nutrition advocacy. We are engaged with a lot of national and international stakeholders, including our own state of Gujarat. We also work with the unreached population of women behind the bars, that is prison, institutions, childcare institutions, disadvantaged populations, as well as the street children. We also contribute in several programs and projects of the government. The recent one is the Child Nutrition Park at the Statue of Unity in Ekta Nagar. So our extension activities as well as our teaching is something which makes our department a robust place to come study as well as work. We have a very strong alumni association network. In fact, you're watching on Facebook Live on our alumni page. Do follow us on Instagram and YouTube channel too. And I welcome you all to our heritage city of Vadodara. With this introduction, I now invite, I hand over to Abhishek to carry out the deliberations. Thank you so much.
Thank you, ma'am. For today's webinar, I'm happy to introduce Ms. Priyanka Shah, a distinguished public health nutritionist and a proud alumni of the Maharaja Sayajirao University of Baroda. She currently serves as a faculty member of the Indian Institute of Public Health, Gandhinagar. Ms. Priyanka Shah's doctoral research delves into sibling dynamics and their influence on childhood stunting. She has led projects on nutrition and WASH practices in rural and tribal communities of Gujarat. In addition, she contributes to Action Against Stunting Hub, where she works on developing models and generating field-based evidence to address undernutrition. She is also an active member of Center of Excellence in Nutrition at Indian Institute of Public Health, Gandhinagar, which serves as a technical advisor for PM Poshan. Passionate about advancing solutions, reduce stunting, she works to connect research with practice while monitoring public health professionals. I would like to invite Ms. Priyanka Shah, and I will hand over the presentation.
Thank you, Abhishek. Good afternoon, everyone. It's always an honor to be back at our own alma mater. I I have shared my slides. Can someone please share it?
Nikita, who has the slides?
Ma'am, Abhishek is having the slides, but I can share also.
Please share.
Yeah. Priyanka, slides are visible to you?
Yes, they are visible.
Okay, you can start.
Please make them full screen.
Okay.
Thank you. So, as you all know, Poshan Month is not just an observance, but a national movement to prioritize nutrition and child health. So, today we'll be discussing on IYCF and stunting nexus and why we must look beyond nutrition in the first 1,000 days, which is a critical period and a window of opportunity also. Next, please.
Priyanka, just give me a moment.
Sure.
Yeah. It's not able to.
Yes, it's visible. Okay. So when we talk about malnutrition, what often comes to our mind is wasting or underweight, a child looking thin or having a visible undernourishment. Stunting hardly comes to a layman's mind. So, which stunting is about low height for age, which is often caused by chronic undernutrition and repeated bouts of infections, especially in those first 1,000 days. Globally, if we talk, 148 million children under the age of 5 are stunted, which accounts to 1 in every 3 children are being stunted. 33% of burden comes from the South Asia, and out of that also, one third of these stunted kids they reside in India. So, how WHO defines stunting as is as a child whose height for ages more than 2 standard deviations below the median of WHO child growth standards. But what makes stunting dangerous is that it is a silent undernutrition, I would say. Parents may not recognize it immediately. Child may appear normal in the daily life, but it's actually being robbed of with its full potential. Next slide. So let's understand some demographics. Stunting has been reduced slightly from our last NFHS 4 to NFHS 5 data. But of course, the Gujarat data, what it says is it has a slight increase in the prevalence of stunting. Next. So why should we worry so much about stunting? First of all, stunting has an impact on the cognitive and physical development of a child. A stunted child often scores low on the tests of learning ability. They might have reduced memory, attention, and also reduced problem solving skills. Physically, they would be shorter, weaker, and would be less engaged in activities that require strength and stamina. What the World Bank says is a 1% reduction in the adult height is linked to a 1.4% loss in the economic productivity. And stunted adults might earn 20% less as compared to their normal peers. and there are there are a lot of health risks that are involved. If a child is stunted, he or she is more likely to develop non-communicable diseases later in life, like diabetes, hypertension, CHT, because of their bodies have adapted to early undernutrition. So that's why the World Health Assembly has set a target to reduce stunting in under 5 children by 40% by 2025. And unfortunately, India currently is off course in meeting the target. Next. Let's understand this framework, which explains the causes and consequences of stunting. We'll go it by step by step. So stunting is not just being short for age, it has both long-term and short-term effects. The child might have higher risk of illness and death. It has delayed cognitive, motor, and language development. It increases financial burden on families due to the medical costs. And in the long term, the child may have shorter stature, increased risk of obesity, chronic diseases, and poor reproductive health. Academically, they might perform poorly in schools, having lower learning capacity. And this economically translates into reduced work capacity and productivity. So it's not just a childhood problem, it impacts the individuals, families, and the entire society. So, why does stunting happen? It might happen because there are poor maternal nutrition before and during pregnancy and lactation. There are early pregnancies, infections, short birth intervals, and low birth weight. There might be poor home environment, lacking stimulation, poor caregiving. There might be food insecurity and inadequate wash and caregiver education. So there can be inadequate complementary feeding, which would be low in quality foods with poor nutrient content. Improper feeding practices such as too thin or too infrequent feeds, unsafe food storage and preparation. Even if breastfeeding is done well, but if complementary feeding is poor after the 6 months, then the child fails to grow properly. Another cause can be delaying in the breastfeeding or not exclusively breastfeeding the child till 6 months or stopping it too early. Another cause can be the frequent diarrheal or respiratory infections.
प्रेशर कर रही है लगता है मुझे.
Okay. Infections that can cause loss of appetite and chronic inflammation. So this creates a vicious cycle. And finally, all of these aspects are influenced by the broader social, political, and environmental context. The food prices, poverty, trade policies, employment opportunities, they affect the family's access, maybe physical or economical access to nutritious foods. If healthcare is inaccessible or it is weak, then the maternal and child health can suffer. Parents' education, especially the mother's education, has strongly influence on the child feeding and care practices. Whereas gender norms, women's status, and cultural beliefs also affect the feeding decisions. Food production, availability, and safety determine what a family will eat. Coupled with proper poor wash facilities, climate change, and urbanization, this increases the infection risk. Next. So science shows that the first 1,000 days from conception, the period from conception till the child's second birthday, are most critical for the health and overall development of a child. During this time, nutrition and care have the maximum impact, and about 80% of brain growth happens in these 2 years. So, if a child lacks the right nutrients, the brain will literally wire differently, reducing the learning potential and the IQ of the children. Immune system is also programmed in these years. A well-nourished child develops stronger defenses against common infections. And if there are repeated infections like diarrhea and pneumonia, this can worsen the nutrient intake and undernutrition. So if this opportunity, if this first 1,000 days are missed, the catch up is difficult. And that's why most of our interventions are focusing on these first 1,000 days. Next. So yesterday we learned about the IYCF practices, a set of recommendations given by WHO for appropriate feeding of newborns and children under 2 years of age. So what they state is there should be early initiation of breastfeeding. It should be immediate feeding after birth or at least within the first hour of birth, which will ensure that the child has received cholesterol, which is rich in antibodies, and it will lower the neonatal deaths significantly. The second one is exclusively breastfeeding the children till first 6 months of their life, which means not giving them any prelactals or even water. Timely introduction of complementary foods after 6 months. This is when breast milk alone will not be sufficient and a nutrient dense food must be added to the child's routine. Then, after 6 months of age, there should be dietary diversity and frequency between 6 to 23 months of age children. The child should be fed cereals, pulses, and all the food groups at least 3 to 4 times a day or at least age appropriately. And lastly, what the guidelines say is responsive feeding, which means feeding with patience, love, and interaction, and not forcing the child to eat. It stimulates both the intake and development of the child. Next. So we have the evidence for the IYCF and stunting nexus. So children who are breastfed within the first hour of birth are less likely to die and are also less likely to suffer from fatal diseases at times like diarrhea. Exclusive breastfeeding improves growth, prevents infection, and it also lowers the hospital admissions. But if there's poor dietary diversity after 6 months, which is one of the strongest predictor of growth faltering, there has been a visible impact on the growth of the child. Certain research on environmental enteric dysfunction shows how gut damage from infections reduces the nutrient absorption, which afterwards worsens stunting. Certain meta-analysis, which is the collective verdict, you can say, of primary studies, they state that IYCF interventions, when combined with infection control, have the potency to reduce stunting by 20 to 25%. Next. So we can say that nutrition cannot alone solve stunting. As nutrition isn't linear, its solutions should also be interdisciplinary. One such factor is WASH, or water, sanitation and hygiene practices. The children who drink unsafe water or live in unhygienic environments are exposed to repeated infections and intestinal worms. This steals the nutrients and blocks their growth. Open defecation also, it still persists in many parts of the rural India, which contaminates soil and water. So even if food is nutritious, children may not benefit if their gut is, constantly fighting with the germs. Simple practices like hand washing with soap, especially before food preparation and after feeding the child, can reduce diarrheal diseases dramatically. Next. So we have certain regional evidence. I'll be talking about three studies that were conducted in Gujarat itself. The first one is the ethnographic formative study, which was largely done on the rural area of Gujarat in the Sabarkantha district. It was to deep dive into the local cultural practices and beliefs surrounding the IYCF practices. The second was a nested control, cohort study, which was a longitudinal follow-up of children to track their overall growth trajectories and identify what are the key determinants of stunting. And the third, which is still an ongoing study, is a sibling dynamic study, a nested case control study, where we wanted to look at what are the striking factors where within a household we can find disparities among the nutritional status of the child. Next. So this was the study that was conducted in the rural setting of Gujarat. So we stayed with the team stayed with 4 stunted kids and 4 non-stunted kids, and what we found was significant disparities between both the groups of children and also their families. So stunted children had fewer frequencies of breastfeeding and consumed more packaged foods. Hygiene practices were also found to be better in non-stunted or the normal child's household, including proper storage. They had proper hand washing and sanitary environment around them. One factor that we found was animal exposure and sanitation conditions. The children who were stunted, they were involved more in the animal rearing practices, and after the exposure to animals, the hygiene practices were not properly followed. So the study helped us to highlight certain critical need of interventions, focusing on the positive behavior change towards good dietary and wash practices. Next. So this formative study led us to our nested cohort study, where around 1,200 children were followed in the two distinct geographies. One was a rural setup and one was a tribal setting in the Sabarkantha district, where these children were surveyed on various variables. This was, of course, a part of the larger Action Against Stunting Hub project, which is a multi-country project that was going on in India, Indonesia, and Senegal. So these children were followed since their birth, and what we found out was there were the poor IYCF practices were observed, and it was linked with increased morbidity, fewer intake, and frequent admissions to NRC and CMTC. There was a high prevalence of stunting, much also higher than the national average. 43% of children were found to be stunted. Next. So why research was and is important? So we must recognize that it is not just a nutrition problem, but a multidimensional problem. And the solutions need to be interdisciplinary. Convergence between the nutritionists, public health professionals, sanitation experts, agricultural scientists, and social scientists is the need of the hour. Longitudinal designs are particularly valuable. They allow us to track children over time, see when faltering begins, and identify the most effective intervention windows. Finally, research should be translated into action, and it shouldn't be just confined to our publications, but it also must be communicated effectively with policymakers, program managers, and communities. Next. So let's see what the international success story says. In Brazil, between 1974 and 2007, there was a reduction in stunting from 37% to just 7%. So how did they do it? It was, they focused on these parameters. They strengthened the economic empowerment, cash transfer programs, and minimum wage hikes were employed. Female education was strengthened. They empowered the women to make better choices for their children. There was health service expansion, prenatal care, immunization, and community health services were strengthened. Massive expansion of clean water systems was done, and strengthening local food systems for better production and availability of healthy foods was done. So in a way, Brazil taught us that stunting can be reduced when social policies, health systems, and economic development can come together. Let's see a story of India, one of the states of India. Next slide. Next, please. State closer to us, Maharashtra. In 2005, 44% of children under 2 were stunted. By 2012, this had fallen to 22.8%. The Rajmata Jijau Mother, Child Health and Nutrition Mission was the main program that caused this decline. This mission focused strongly on the first 1,000 days, used evidence-based policy advice, and ensured convergence across departments, health department, WCD, and WASH. So Maharashtra has also shown a strong political will, scientific guidance, and community mobilization, and that progress is possible even when India's setting is much complex. Next. So at global level, the WHO and UNICEF has given us the IYCF strategies, and they have given us there are the sustainable developmental goal, especially the 2.2, which states that all forms of malnutrition should be ended by 2030. India also has made strong commitments. The Poshan Abhiyan, which was earlier known as the National Nutrition Mission, launched in 2018, focuses on the convergence, technology, and community participation, integrates multiple ministries, leverages technology like the Poshan Tracker for monitoring, and promotes convergence and focuses on community based events. The central aim of this policy is to reduce stunting, underweight, anemia, and low birth weight. The next is the ICDS, which was launched in 1970, the world's largest community-based outreach program. We all know the establishment of Anganwadi centers underneath it, and which provides the supplementary nutrition, health checkups, growth monitoring, immunization, and preschool education is given. Now there are Saksham Anganwadis are being strengthened with digital tools and improved infrastructure. Recently launched or revamped PM Poshan, which ensures hot cooked meals in schools for children up to the 8th standard. Beyond reducing classroom hunger, it enhances attendance and learning outcomes and is vital social safety net for the vulnerable households. And there is the Anemia Mukt Bharat, which provides micronutrient supplementation for children, adolescent age group, and women in reproductive age also. So together, these policies represent a comprehensive multi-sectoral response, which would be linking health, nutrition, education, and WASH, stating the principle that nutrition is not just an issue, but a development issue. Next. So despite the progress, there are several gaps. We would look at few of them. First of all, complementary feeding is still inadequate. Many children receive food that is not diverse, not frequent enough, and not energy dense. Only 13% of children in India have the adequate diets as per our NFHS 5 survey. Secondly, the behavior change interventions are often weak. Knowledge alone doesn't change practices, but we need deep, culturally sensitive, and repeated engagement with communities, which will in turn lead to a change in their behavior. Thirdly, the wash practices are also not universal. We still have households that practice open defecation, where hand washing is not practiced frequently, and our frontline workers, our triple A's, should be strengthened, and their training should be strengthened, because they are the backbone of our nutrition programs. Next. Sorry, I was on mute. So, what does this mean for our policies and programs? First of all, interventions must be integrated. Nutrition counseling must go hand in hand with the hygiene education and infection prevention. Maternal nutrition should be prioritized. Iron folic acid supplementation. There should be weight gain monitoring and antenatal care should be strengthened. Community engagement. Our frontline workers. They should be they are and they should be strengthening the counseling on breastfeeding, complementary feeding, and hygiene. We must ensure the program convergence, and finally regular growth monitoring and community and facility level is essential, because early detection of the faltering gives us a chance to act before it's too late. Next. So lastly, we should think critically and beyond food, because stunting, as evidently said, it's not just only about feeding the child. It is more about problems that in a way affect the feeding and caring practices of the child. Researchers and especially students or our outreach programs must engage with communities. Policies and programs must resonate with the people they serve. Innovate in policies and practice. Challenge existing norms. Advocate for evidence based approaches and design creative solutions that can be scaled up. So, as public health leaders, we must go for solutions that are interdisciplinary. And if talking about stunting reduction, it's not just about child health, but building a stronger nation. Next, please.
Thank you, ma'am. Thank you, ma'am, for enlightening us with your views. It was a pleasure listening to your insights. We have some questions. One of them is why focus so much on the first 1,000 days? Isn't nutrition important later as well?
Okay, so yes, of course, nutrition later in life is also important. Uh, but as discussed earlier, during this period, the brain develops rapidly, the immunity is shaped, and linear growth also happens much faster. So the nutrition later in life, it is important for the school performance, adolescent growth, and the adult height. And impact of these interventions later in life can be modest. So I think the return on investment are highest when the focus is made on the first 1,000 days.
Hi, Priyanka. Thank you for a wonderful lecture. I just wanted to ask you, you've studied in this department, right? And now you're working in a different institution. Uh, what kind of training should we be giving in our teaching? Or do you think what we are teaching is just adequate?
Of course, ma'am, that is adequate because I have been trained under you only. So I think both these institutions are, cannot be compared. The nutrition section here at IAPG is budding, but at MSU we have an established uh, nutrition department. So I think, yeah, there's there's no comparison.
Your mic is mute. We have another question, ma'am. That is how can programs address intra household inequities?
So the so programs, they can have a strong behavior change communication, which not only focuses just on the mother, but on the caregivers as well as the fathers also, because many a times they are the ones who hold the decision taking capacity in the household. And yeah, if there are certain programs that can link nutrition with women's empowerment, like the engaging the self-help groups, having some sort of livelihood schemes, can help the women in, making taking the decision power and having some income. Yeah.
Another question, ma'am, we have received is Poshan Abhiyan effective?
Sorry.
One of the questions we received is Poshan Abhiyan effective?
Yeah, I mean, Poshan Abhiyan has introduced community participation through Jan Andolan. It has emphasized on convergence, introducing technology, and because of it, there has been a decline in the undernutrition rates. However, they are marginal. So I think Poshan Abhiyan is well designed with strong potential, but its impact has been modest due to certain systemic issues. So, the points that we discussed, strengthening frontline delivery, ensuring timely funds, and integrating the health services, I think would be critical to, strengthen the Poshan Abhiyan more.
Okay, ma'am. One of the question is related to the quality study conducted by the IIPHE that showed that children involved in animal care. Uh, were there any correlations seen with particular community or caste with this? Or did they belong to any specific community?
So all these 8 children that were studied were from the OBC or SC/ST category, because it was selective from the rural area, and there were. Can you please?
Sorry, ma'am. Should I repeat the question?
Can you please repeat the question?
Ma'am, this question is related to the qualitative study conducted by the IIP that showed that children involved in animal care, were there any correlations seen with the particular community or caste with this?
No, we didn't find any relation or correlation, because this was purely a qualitative study. It was an ethnographic study. So, what it actually means is we stayed with the community and we were purely observing what their practices were. So, yeah, I think we stayed for like 3 to 4 days. So there were not any significant correlations with their caste, because matching was done and children were selected in a way that they match their socioeconomic and caste background.
Okay, ma'am, thank you. We don't have any questions left. Thank you for joining with us today and sharing your thoughts. Uh, So before closing today's session, on behalf of the Department of Foods and Nutrition, I would like to thank our Honorable Vice Chancellor, Professor Dr. Balchandra Bhange sir. I convey my sincere thanks to In Charge Dean Professor Dr. Anjali Pahar ma'am for her support and motivation. Above all, I would like to thank Professor Dr. Vanisha Nambia ma'am, In Charge Head of Department of Foods and Nutrition, for her guidance and smooth conduction of the webinar. Thank you to all the participants for attending the webinar, and all the recordings of the webinar will be available on our YouTube channel. Thank you. Thank you so much, ma'am, for joining today.
Thank you.